Hi, in this video I'm going to just show you the reservoir mask. So this is in your oxygen administration station and you're normally prescribed a reservoir mask, which is a high flow oxygen mask. Okay, so why do we give patients high flow oxygen? So maybe a silly question you might think, Hannah, but obviously when they are hypoxic, so they've got low oxygen saturation levels. So we obviously want to be increasing that oxygenation level, so we're getting oxygen to the cells and preventing any further deterioration and potentially cardiac arrest. So hypoxia is one of the reversible causes of cardiac arrest as well. And we give high flow oxygen through this reservoir mask when patients are severely hypoxic and need that high flow oxygen. Okay, so a reservoir mask has the reservoir, the bag on it, and it's got the tubing, which we would connect to our oxygen flow meter. And these masks are designed to have high flow oxygen, so 15 litres per minute. And the oxygen goes into the bag and fills up. And when the patient breathes, they are just breathing in through the oxygen in the bag. So they're not having an air oxygen mix, which is what you get through a normal face mask. So it delivers high concentration of oxygen, so anywhere from kind of 80 to 100% oxygen is what the patient is going to get through the high flow mask. So remember, oxygen is a prescribed medication, so we need to ensure that it is prescribed, and we need to do some checks on this mask before we set it up. So we'd want to connect it to the flow meter, turn the flow meter up so the ball bearing goes up to 15, and then we need to occlude this valve here. So there's a valve on this mask, see that? Okay, and we want to just make sure that this is working correctly and the bag is inflating. It's an important safety aspect with your oxygen mask. So I'm going to put my thumb over here and then my bag is going to inflate. So it tells me firstly that my oxygen is being piped through correctly, there's no leaks or any breakages in this bag, so it's going to fill up correctly and my patient is going to get the prescribed amount of oxygen that they need. So really important part there of checking our mask. We need to make sure the mask is a correct size for the patient. It's not going to be too big and have lots of gaping seals, and it's not going to be too tight either. Once we've done our checks, we're going to place it over the mannequin. And we want to tighten up the straps because we do want a relatively good seal without it causing any damage as well. And we want to check that's comfortable for the patient and it's sitting nicely on the nose and it's not sitting too low on the chin either. Whenever we're giving high flow oxygen, we need to make sure that we are assessing and reassessing the saturations. Okay, so we'd want to ensure we check those saturations and we should see hopefully quite an immediate response, but we want to make sure they are within those target range of 94 to 98%. Because of where the mask and the strap sits, we always want to check for any pressure damage. I'll be checking my mannequins, like the nose, bridge of the nose, the cheeks, the side of the face, the ears and the back of the head, because we can get pressure damage. And oxygen is obviously really, really drying. So we want to make sure that we're offering regular mouth care or sips of water if the patient is able to prevent that drying of the mouth, because if the mouth gets very dry, it's going to become very painful. There might be some ulcerations. It can increase the risk of kind of infection as well within the mouth and gums. And it can affect patients' well-being. They don't want to eat as much because the mouth is very sore, so it impacts their nutrition as well. So key things to think about with your reservoir oxygen mask and when you're delivering high flow oxygen.